Next we have Clancey McKenzie, MD. Oh, wonderful. Philadelphia psychiatrist, critical of the psychiatric industry and the DSM, Dr. Clancey McKenzie is a psychiatrist in Philadelphia who is highly critical of his own psychiatric profession. Dr. McKenzie is an acclaimed authority on helping individuals diagnosed with schizophrenia and post-traumatic stress disorder. Dr. McKenzie is board certified in psychiatry and neurology and is a recipient of Temple University's Mandela Humanitarian Award for Community Work. Welcome.
Thank you. Thank you. If anyone here is at all impressed with the American Psychiatric Association, let me remind you that over the last few decades, there is an increase in bipolar disorder, 40-fold, autism, 20-fold, school violence out of control, drug and alcohol incidence is rampant. And so I don't think they have much to boast about with their DSM. It was about 30 years ago, my work was different from other physicians, and so it drew a lot of fire. You don't have to do anything wrong, just do something different. I was going to write the book Hung by the Grapevine, but then I noticed what they were doing to my patients. They were really brutalizing my patients. One of my patients who got out of the mental health into the welfare system, I traced him through 9 institutions where they really brutalized him. Some of my patients died as a result of what took place, and it's because they were critical of me for my new ideas. Well, I became a patient advocate. When I saw what they were doing to my patients, I sued 17 psychiatric institutions and their directors, and that included State Hospital, the Commonwealth of Pennsylvania, 2 university hospitals, and on, and all 17 paid. So. My work was an accidental finding in 1966 when a child training analyst told our group that the origin of childhood schizophrenia was the first 18 months of life. I checked my adult patient population and noticed that half a dozen of my patients with schizophrenia had a sibling about 1.5 years younger, and as many of my non-psychotic patients had a sibling about 2.5 years younger, and in no instance was this reversed. Well, that's like flipping a coin 12 times and correctly calling it 12 out of 12 times. 1 chance in 4,096 by chance alone. Later, and from that, I began to pay close attention to symptoms of a patient who had a disorder and had a younger sibling, and soon I was able to match the symptoms with the age the sibling was born. Now that's only 1 out of hundreds of infant traumas, but it was my measuring stick. And from that, I was able to identify symptoms so that I would meet with a patient. Like for the first time I met with John Nash of A Beautiful Mind, I told him that the age of origin of his disorder was between 15 and 16 months. It was obvious. Then we learned when he was 15 months old, the stock market was 400. When he was 16 months old, October 1929, it was 200. Mothers who were devoted to the baby suddenly shifted to survival. That's all it takes. So for the last 45 years, I've been identifying the other traumas. I'll say one more thing. Years later, I did a second study with 15 patients who were depressed and who also had a trauma less than 3 years younger. And the 7 was psychotic depression. The trauma was less than 24 months younger. The 8 was non-psychotic depression. It was more than 24 months younger, between 24 and 34 months. Now that's 1 over 2 to the 15th power. And then recently I realized these 2 studies were sequential, which makes it So they're cumulative. There was no other studies in between. That makes it 1/2 to the 27th power, or 1 chance in 134 million. Now this has been tested checked with statisticians, and it's valid. So we don't have the DSM. What we have is delayed post-traumatic stress disorder. First 18 months, it's the various schizophrenias. 19 through 21 months is the schizoaffective disorders. 22 months is the peak age of origin of bipolar disorder, hypomania. Up to 24 months is the rest of the psychotic depressions, and 24 to 34 months are the non-psychotic depressions. We can eliminate that half of the DSM because we've proven it to 1 chance in 134 million with the data. Thank you very much.